Welcome back to Dynamic Joint Season 2.
Whoop, whoop.
We are today going to be talking about the pros and cons of therapy in the various settings. So make sure you stay tuned and like, subscribe, and share.
And notify.
Right.
Ding.
And then don't forget to stay to the end because we have our dynamic roulette, which we will give out healthy therapy tips to you. Enjoy. It's okay.
Episode of Dynamic Joints Podcast.
That's right.
It is yours truly,
Angie. I am the occupational and physical therapist in this group. That's why it's a duo, because I'm like dynamic. It's me. It's all me.
And I'm the one that you love. I'm the one that makes your world go round. Every time you see me, it makes you happy. I'm your physical therapist, Dr. Tyre. And today's topic,
the pros and cons of working in different settings.
And why can we talk about this?
Because we've worked in many settings.
Ding, ding, ding.
Now, how did you go about working in many settings?
You dragged me.
That's true. But we won't talk about that just yet.
You bullied me.
So we worked in a lot of settings because we did traveling therapy.
We did.
Which I think is an amazing way as a new grad to kind of get out and see what you really like because they're temporary. I like change, so 3 to 6 months and you're on to your next contract.
Yeah, because you wasn't involved with office politics, so you really didn't care. You cared for doing your job and your patients, and it was also like a paid vacation, if you will.
Right.
Especially when we lived in Hawaii and Alaska and California.
Right.
And Texas.
And Washington.
And Washington State.
All of it was nice because we had never been there before.
Right.
And you create these new circles of friends and you learn differently. Like we've talked about before, Dr. Tyre and I have the same schooling, so we think alike when it comes to therapy, but working in these different states and with these different people, you learn different techniques, interventions, and you learn how to talk to people, which I think we all know is what's going on with this world today. But knowing how different people operate and their cultures behind allows you to get to them on a different level, and you all see that we're all human at the end of the day and we just want to have fun.
Yeah, and that respect component
matters
a long way. So we traveled like she said, like Dr. Angie said, and we were exposed to different settings when it came to the therapy world, one of them being skilled nursing.
Oh yeah.
And I liked being in the skilled nursing facility because, so going back, what is a skilled nursing facility? It's usually, or short-term rehab. It's usually a place where, say something happened, you were in the hospital for a moment in time, and then you had to be transferred over to a short-term rehab or a skilled nursing facility because it wasn't quite safe for you to go home as of yet. For many different reasons.
Right.
It could be, you may have had stairs at home and it wasn't safe for you to go up and down the stairs. You may have lived alone. You may not even had a home to go to. So there's different reasons of transitioning from a hospital setting into a short-term or a skilled nursing facility.
Right.
But I chose to talk about that first because that was my first experience as being a new grad, was in a skilled nursing facility. And working with the geriatric population, or our golden years, sassy seniors, that was very,
exactly.
Yeah, it was really fun because one, you get to learn about their lives when they were young, right? And two, you get a chance to do some, I wouldn't say unconventional things, but you were able to think outside the box. Well, we did.
Right.
Because we saw that they were doing like the mundane routine of kicking your legs out or doing seated marches or squeeze the ball.
Right.
And
walk away.
Right. And it wasn't exciting for them. So we took a step further.
We did.
We asked them what it is, what was it that you like to do when you were in your younger years or when you were young?
What makes you happy?
Right.
What are your hobbies?
Absolutely. And so one memory that I had was it was a gentleman. He was confined to his wheelchair. He was an older guy and he liked roller coasters. Okay, I can't replicate a roller coaster.
You fling them down the stairs.
No, I can't. I can't do that. But what I could do was run down the. Now, was it safe?
Probably not.
Probably, but what
Because I recall y'all running, and you had the rehab director on edge because at one point you were only on one wheel.
Well, the thing about it was, if he wanted the roller coaster experience, I was going to give him that roller coaster.
And that you did, because I remember the smile on his face. He had no teeth, but his smile was so big, and he had his arms in the air.
Yeah.
He wasn't afraid at all.
He wasn't. And so just, again, thinking outside the box to bring fun to therapy,
Right.
because at the end of the day, if you're like me, I don't like to exercise. And I don't like people telling me that I need to exercise.
She does need to exercise, so we'll talk about that.
With that being said, if I can make your therapy experience fun, then I'm going to do so.
Right. I think what I realized with traveling, and traveling therapy will be a whole nother episode, so you guys stay tuned. But what I realized was that when we worked in these different settings, in these different areas of the U.S., that we realized that family units are totally different, right? My first job was here in Florida at a SNF, or a skilled nursing facility rather. And I remember there was this lady, she was about 70 years old, very spunky. She was definitely sassy.
He was a sassy senior.
And she was stuck in the SNF because she had no family or friends here. They were all lived up north, and she couldn't go home. And the one thing that she needed help with was getting on and off the toilet. She had trouble standing up. So you can't send her home because she has to use the bathroom.
Absolutely.
And so she was stuck in one of these facilities because she didn't have the support she needed. Whereas when we went to Hawaii and even in Washington State, the family unit is there, and they will stop working. They will do what they have to do. They sacrifice to make sure that their loved one can be home. And what I notice is that people get better at home versus being in these skilled nursing facilities usually because they are around their loved ones. They're around people that want them to get better, and they don't want to be a burden on their family, so they're actually going to do better.
So then, speaking of homes, another setting is home health. And that's exactly what Dr. Angie was just mentioning not too long ago, was you're having your therapy sessions in home. So as a therapist, speaking from a therapeutic perspective, our job is to make sure that they're able to navigate their home in a safe manner from a physical therapy perspective. Are they able to go about their business?
Right. Is the floor
In a safe manner, right?
The floor space open? Is it closed? Do they have, is their bed high? Is it too low? Are they pretty much sleeping on the floor? Like all these stuff you think you understand about people, you really don't until you go into their space.
Yep, absolutely.
I also think that's where I learned how to do therapy the best.
Because definitely, I said thinking outside the box in a nursing facility. Like at least in that facility, you had tools, you had exercise equipment, you had things that you can pick and choose and make your interventions inviting, exciting, and engaging. At home, it is just you and the patient.
Right.
Whatever you have in your bag that you take in with you.
Right. And you don't want to take a lot because some houses are very clean and some are not. Some people have a lot of space, some people don't. I remember I worked at one person's house. The only space that we could work in was literally around the recliner. So it's about 2 to 3 feet in front and the sides. That's it. That's all the space they had because they were hoarders. So I'm not going to take a lot of my stuff in because whatever pests they have, I'm not trying to take them home with me. But I'm also not trying to use that free space that they have up. So I'm going to take as little as possible. So I have to be as creative as possible because I need them to get better. I don't care what your home life is like. I need you to get better.
Absolutely. And then it just takes your therapy skill or your people skill to another level because you don't ever want to make someone feel uncomfortable in their home, right? So even though you may be uncomfortable as a therapist and your skin may be crawling because a bug fell on your lap.
You remember that time I was in Hawaii?
Girl.
And that 747?
A flying roach
and they're huge. They're probably the size of this microphone. Flew out of nowhere and landed on me. Now, mind you,
I would have passed out.
I'm talking to this lady, and I'm trying to be very like, I already know we got little bugs in here. It's okay. I don't care about that. I'm here to treat you.
Passed out.
When that thing flew on me, I had no words. It was like a convulsion.
Passed out.
Screamed, and she was like, "What's wrong?" "Oh, nothing. Nothing at all." I'm going to straighten myself out. Let's continue.
Absolutely.
But it's a learning lesson, right?
is.
Because it's her home, and she invited me into her home, so I have to respect it at all costs.
Absolutely.
So there's going to be no way that I'm going to show her that I'm slightly disgusted and that
And afraid.
yes, because that thing was huge. If it had flew in my mouth while I was talking,
I would have died.
oh my goodness. So, but different settings require different things, and you have to be okay with that because you
Absolutely.
never know what you're going to get yourself in.
Absolutely. And so going into another setting, which is, I mentioned earlier, hospital, or we call it acute care. This setting is kind of like the hustle and bustle, if you will. You get them in, you get them out. Not because it's a the hospital is a revolving door.
But that is why it's a hustle.
Yeah, because it's a quick turnover. It's a quick turnaround to get the patients well, safe enough to go to the next setting, right? So with acute care, you may not be able to know your patient on a personal level as if you would when in a skilled nursing facility or in a home health, because they may be in a hospital depending on the diagnosis and all the other things that are going on. But on average, just your average person coming in from the hospital, going to the hospital because of maybe back pain or whatever the case is, they may spend between 3 days,
I would say 3 days.
3 to 5 average.
Right. They're not there typically longer than
Yeah. And so basically it's a quick, what can this patient do? Can they get up from the bed? Can they walk down the hall? Can they turn around and walk back to their room? Because that's the thing that the doctors need to sign them off in order to go to another facility or home.
Right. And I think these all kind of set up on each other. So usually after a car accident, usually after somebody's gone to the ER, they get put up into the hospital room. We come in and see, okay, what are you able to do? That determines where you're going to go next. So if you cannot get out of bed by yourself, if you cannot stand up, if you cannot walk, if you don't have family support, you're more likely to go to a short-term rehab or a skilled nursing facility. And if you can do those things, then they're probably going to have you have therapy at home. So it's just kind of like a stepping pattern of where you're going to likely get your therapy from.
And again, hospital stays depends on the severity of the case. If a patient has a stroke or some kind of traumatic brain injury or something extensive, they're not going to try to rush that patient out. They have to make sure that that patient is stable enough in order to go to another facility to continue with their rehab.
Right. And even if they're not medically stable, you still do therapy on them.
Absolutely.
So there's therapy in the ICU. There's therapy right after a heart surgery. There's therapy right after you got your hip replaced. They're getting you up and they're moving. Whether we have to take the IV, the all the cords for trachs and oxygen, whatever the case may be, we're getting you up and moving. So I would say the hospital stay requires a lot of manpower. You have to be mobile because you don't know how much the person is going to weigh, but you got to get them out of the bed. You got to take them to the bathroom because the nurses are overworked and understaffed, so they probably haven't gone to the bathroom, and you don't want them using it on themselves. So you have to be able to maneuver patients with all of the extra medical support that they need as well.
And you have to, again, not just think in your bubble of, oh, this is just what PT does, or, oh, this is just what OT does, because like Dr. Angie said, the patient may have to use a bathroom. I know from personal experience working in the hospital, and for whatever reason, they don't like the patients to wear their underwears or undergarments or anything like that. So let's just say Mr. Bob has to use the restroom and he cannot hold his urine or his bowel movement. Guess what's happening? He is using the bathroom on the way to the bathroom.
Yeah.
And what do you do as a therapist? You act like that does not faze you at all. I typically would say we all have accidents.
Right.
It is A-okay. We would get someone to clean it up. And usually 9 times out of 10, that someone was me.
Yeah.
Because
We can't find
you can't, and it's a challenge, right? And then when you said, as far as going back to the ICUs and things I mentioned, having different lines, the patient has to have different lines on them.
Mm-hmm.
The therapist works very closely with the ICU nurse. They are amazing. They are amazing, and they care for their patients. So with that collaborative care with the nurses and therapy staff, it's easier to have a patient that may be in a semi-comatose state sit at the edge of the bed because they need that.
Yeah, for their get off their back.
Right, for their lung capacity and things of that nature. Or for, like you said, that patient that just had open heart surgery and they can't use their hands to stand up. We have the nurses making sure that their lines are in order, as a therapist is responsible for helping them get out the bed and into the chair. So that's just a little bit of what acute hospital care setting is.
And what's required to work in it.
Absolutely.
We have peds, right? So working with children in all states, right? Sometimes it goes to always think about people, oh, the kid fell off the monkey bars and need therapy, right? There's also kids that have some type of disability, so cerebral palsy. They are learning how to use their body because their body is not working the way it should. So coordination stuff. I mean, we've had children on the spectrum that we've had to work with and try to teach their good behaviors, right? This is what we do in order to be in the classroom. This is how we write. This is how we hold stuff. Some children have sensory issues where they don't like certain textures. They don't like to be hugged. We try to teach them that their body, they've never been in this before, and they're experiencing things that they've never experienced. So our job is to tell them that things are okay or they're not okay. How do you manage it?
And I get excited because I love peds. You may or may not have noticed I'm a kid at heart.
They notice.
And so what I do with the kiddos is play.
That's all it is. But it is structured play.
It is.
And what's ironic is that the things that we do with the little ones, we can do with the seniors.
Yes.
Because at the end of the day, we all enjoy playing.
Especially me.
Get that balloon out. Volleyball it on up.
Kick that ball to the goal line.
Right.
Absolutely.
Tag.
Don't step on the hot lava.
Oh, parkour, right? Flipping over things. I don't know how many times I played hide and seek and seen the little ones hiding.
They read just like this.
Right. And then you're like,
you can see
no, where's Dr. Tyree? I don't know where she is. I don't know. But it's fun and it's all play. And it's exhausting, but because you have to have the same amount of energy at 8 o'clock as you do at 5 o'clock, because every child deserves you at the best.
Absolutely. And then, so you talked a little bit about the school setting, but I have not had the pleasure of being in a school setting, but you have. So tell our listeners about that.
So some of the times we are like, we need to kind of get these students to hold their pencils right. They're having trouble cutting. They're having trouble coloring because they don't know how to move things. So my job as a therapist in the school setting can be that simple as teaching them how to do school. But there's also a setting where there may be children that are on disabilities that need to be able to participate in the classroom. So if a child needs a stander, if they need a wheelchair frame desk, if they need special things to sit, so kids that may have sensory issues or ADHD, what kind of things can I get them to be productive in the classroom and focus? So we all want to make sure that everything that they're doing is geared to being successful in school. So it's a rewarding situation. It's definitely more challenging because you have school and then you have home.
Yeah.
And it's hard to transition the two.
Absolutely. And then last, but our setting, outpatient.
Right.
Whereas that means that our patients actually come to our clinic and we do exercises.
Right. That's actually my favorite because I get to harass people for a longer period of time. So I get to know more about them. They get to know more about me. We create this trusting relationship. And Although it's not a revolving door like a hospital, it is a revolving door because anytime they have an issue, they will be back because we've created this bond that they can trust me because I'm trustworthy. I've gotten them better before. So if their neighbor has an issue, their neighbor will be coming here, which is now happening, right? We're running overflow. But you tell somebody that they're doing good, and then they're going to go and they're going to find out who's that therapist that helped you.
Absolutely. And so just to provide the therapist or potential therapist some tips in transitioning between settings, because we've done that for almost 8.5 years of doing traveling therapy. My tip for you is just to have an open mind, right? Because of each setting requires different skill sets. And so what you have to do is be able to manage those particular skill sets and apply them in appropriate settings. So you will be successful and your patients will have success as well.
Right. And I would say mine it is having an open mind, but it's also being to listen, right? Because no matter what setting you're in, your patients has goals. They want to be able to do something. And it doesn't matter where I'm working, I have to get them back to doing that. And so keeping an open mind while you're gearing every therapeutic session to making them feel successful and meeting their goal. I think that's really, really good.
I think, and that is a good way to go into our
dynamic roulette, which we have newly introduced because we have requests of what people should do with their bodies in a healthy manner to stay healthy.
And just to give you this tidbit, this isn't an end-all, be-all. This is not a way to cure your ailments if you have. So we advise that you go and seek out medical attention, whether it's from your doctor or your physical therapist, to see exactly how they can help and assist, okay?
Right. So, are we digging in?
Dig.
All right, I picked it out. The question, managing arthritic pain. A lot of people have it.
They do.
A lot of people are denial they have it. And a lot of people think it's the end of the world because they have it. So, what would be your biggest tip?
My biggest tip is to listen to your body, right? I think what happens is when we have arthritic joints, whether it be in our hands or our knees or our hips or even our back or our neck, it's we tend to ignore the signs of this feels like abnormal pain. So definitely I would stretch just to help alleviate some of that joint compression.
Right.
I know that with you and your lady who had hand pain that was due to arthritis, what did you do for her?
I let her know that movement is key, right? So sometimes it's painful and that's why people stop moving and then it becomes more painful. But you have to go through pain to get out of pain. But if that has happened to you before, what I would say is go get in a swimming pool. Let your body start moving through the water and it's going to feel really, really good. But once you do that, now you have to move it onto land because water takes away body weight, which means that you don't have as much pressure through your joints. It's going to feel good. But when you come to land, you still need to work on moving.
And I remember you talking about your lady that had the hand issue with her grandchildren. So if you want to know more about that story, we ask that you go back to season 1 and check out that episode because that was a really good story.
Every story matters.
Every story does matter.
Arthritis is bound for each and every one of us, so keep moving.
Absolutely, because we do wear and tear on our body.
A lot of it.
Yep, and we
especially under the age of 21.
And you are clearly,
let's not talk about it,
clearly over the age of 21.
I'm 26.
The lies you tell. Well, thank you again for tuning in to another Dynamic Joint episode. We ask that you like, share, and subscribe. And don't forget to click that notification bell and notify your friends and family.
Right. Let them know that we're great.
Beyond great. Take us out.
Da-da-da-da-da-da-da.
Ooh, that was good.
Thank you. That's all I have. I appreciate you all for watching. Stay tuned.
Until then.